Everyone, my name is Kristen Schmidt and I'm going to be talking about nurse burnout today. So what is burnout? Burnout can be described as when healthcare workers have reached a stress level from work that leads to physical and mental illness. Nurse burnout has been witnessed in multiple facilities throughout the world, which has turned out to be a huge issue in healthcare. Nurse burnout is a known phenomenon according to multiple studies and Yao's research team who studied self-efficacy and personality types that affect burnout. Because of this, it is important to research what causes nurse burnout and what can be done to combat the issue. Nurse burnout is something I believe is very important to study, as I have seen it happening firsthand where I work, if not suffering from it somewhat myself. Nurses are worn out, which is affecting the care that is given to patients. The purpose of this presentation is to address nurse burnout, who is likely to suffer from burnout, and what can be done to help combat the issue. The Research Pico question is, in nurses with burnout symptoms, are programs and support groups beneficial to decreasing mental and physical illness compared to those who do not participate in support groups? So the P is nurses, I is programs and support groups, C is nurses who do not participate in any means of decompression, and O is decreasing mental and physical illness. For the literature search, while searching for articles that discuss nurse burnout and programs that were put into effect to help overcome nurse burnout, keywords such as nurse, burnout, symptoms, mental, physical, and reduction were used. These subject headings allowed for multiple articles to show up in the literature search in the databases of PsycInfo and Medline Complete. When choosing the 5 articles, it is important to choose relevant articles in a timely manner. In this case, it is important to choose articles within the past 5 years so that we can compare that data to what is currently happening today. It's also important to ensure that the articles are not literature reviews. Oftentimes, literature reviews can be compared to a newspaper article, which may be interesting but not what we want as an article to support our data. It's also important when choosing articles that there is actual data that the researchers are measuring or analyzing. At some points, it was frustrating to find articles that you think are appropriate for the project. Personally, I always seem to have a different idea of what the articles should consist of. However, since nurse burnout has been such a huge topic recently, there were many articles to choose from, which almost made it easy but difficult at the same time. So who is at risk for burnout? According to Yao and his colleagues, they conducted a study in China to see who was at risk for burnout symptoms. The study researched personality types and self-efficacy in relation to burnout and job-related stress. The researchers found that those with low self-efficacy and introverts were at a higher risk of burnout and job-related stress. Guyo and colleagues found that nurse burnout was correlated to decreased resilience. This meaning, if nurses are experiencing burnout, they are less likely to recover from the job stress so that this can lead to physical and mental symptoms. Now that we know what individuals are most likely to suffer from burnout and work-related stress, let's talk about what can be done to combat that stress. Lin and his colleagues conducted a study to assess the effects yoga may have on work-related stress and burnout. These researchers found that those who participated in yoga sessions showed a significant reduction in work-related stress. Ireland and colleagues also studied how mindfulness programs can help decrease burnout and stress symptoms. The study revealed that those involved in mindfulness programs showed significantly decreased amounts of work-related stress and burnout. The mindfulness programs consisted of not only theoretical material, but exercises such as deep breathing. Rong Wei and colleagues also studied whether interventions would help combat nurse burnout. Active interventions within the study consisted of education on communication skills, different ways to approach conflict, increased self-efficacy, and how to control emotions. These interventions helped to decrease burnout in comparison to those who did not receive this extra training. When going through these articles, it was difficult to understand when the researchers were retrieving the data that they were researching. Oftentimes, the researchers were not detail-oriented. They did not give details of informed consent. They often did not mention when participants were being interviewed or when they were filling out the surveys. If a participant was being interviewed or filling out a survey after a rough shift, this may skew the data. Comparing and contrasting. Yuyao, Yao, and Brong Wei studied nurses and the burnout that they experience. Ireland, on the other hand, and Lin both studied health professionals, but they were not necessarily nurses. Nurses and other healthcare professionals may experience different levels and different forms of burnout, so this is um, something we should take into account when reading the articles. All studies found that having interventions such as exercise or educational programs help to decrease burnout throughout participants, so that's important to take note of as well. All of the studies also took place in foreign countries. The United States can use this information to help aid their own studies and about nurse burnout and compare to other countries. Standards are different worldwide, and therefore different programs may have more of effect in China than it would in the United States. Because of this, it was difficult to relate to some of the studies and what they think is best to combat nurse burnout. Personally, receiving extra education is not what I would want to do to decrease my burnout. I would need an outlet such as an exercise class, which is something that the United States could potentially study. When reviewing the literature, it was important to look at the sample size, if the methods seemed to be legitimate, and if the results of these methods seemed to sound bogus. However, all of the articles seem to have reasonable results and seem to have reasonable methods of collecting their data. They also had a decent amount of participants in each one of their studies, ranging from about 40 participants to over 1,000. Management recommendation. Management in hospitals and nursing facilities need to establish an effective management of burnout symptoms, whether it's exercise classes or debriefing with a cup of coffee, so that positive attitudes are adopted and nurse burnout is decreased. Research studies that Guo and Yao conducted suggest that management should provide social support to those experiencing nurse burnout. However, social support and programs should be provided to all nurses whether they are currently experiencing the burnout symptoms. Problems with nursing facilities providing additional social support and programs can increase the cost to the facility. In order for a support group to start, there must be time and money to support the group. The facility may also have to hire someone new to provide the social support, and this obviously increases the facility's cost. Another problem is whether people would even go to the social support groups or exercise classes. After being at work for sometimes 12 plus hours, most nurses and healthcare staff just want to go home. Lastly, if exercise classes are being started, such as yoga mats may need to be purchased. Not only will they need equipment to have the class, but it is also an additional cost to the facility to buy these mats. Even if the facility is providing coffee or yoga classes to help nurses debrief after a tough shift, they still need to be able to have the money to purchase the yoga mats, to have someone teach the yoga classes, or just have the resources to provide free coffee to those that will be attending. In conclusion, burnout symptoms commonly occur in healthcare professionals. Patients are getting sicker and sicker, and we're being asked to do more and more at work. This leads to burnout and stress. Those who work in the healthcare world or those who are considered introverts with low self-efficacy and low resilience are at the highest risk of being burnt out from work. It is important for facilities to recognize those that are at risk of experiencing these symptoms. If facilities are aware of this, they can start support groups, exercise classes, and educational classes to help decrease burnout symptoms with their employees. As seen with the articles in the presentation, interventions that were put into place to decrease burnout was beneficial for all participants. Therefore, I believe that all nursing facilities should at least do something to try to combat nurse burnout and so that they can retain their staff that they have. hope you enjoyed the presentation, and those are my references.